Who wants to build some muscle and burn off some fat, especially at the end of the year? Hey guys, it's Dr. Eric, the fitness physician. We're talking about all things related to health and performance optimization and specifically muscle medicine. That is my area of focus that no one is talking about. It's about practicing for the organ of longevity, which is our muscle. And especially in 2025, that's all I'm going to be talking about, and not all, but mostly what I'm going to be talking about because it's so important. And it's much more than just looking good and feeling good. It's actually improving your health and doing many, many things. I'm going to talk about this in detail, but everyone's interested, especially beginning the new year, getting fit, right? Where everybody gets on the bandwagon of New Year's and they want to get healthy, but the key is to be on this consistently all throughout the year, right? We want to set those habits in place so we don't have to do a New Year's resolution every year to lose that fat or get healthy because we fell off the wagon, right? So today I'm going to talk about a real quick one because this comes up a lot. I see these a lot of questions. I still see a lot of forum chatter online talking about this. I'm going to talk specifically about metabolism, visceral fat specifically, and how this relates to body composition, right? Because again, we want to build that muscle, burn off that fat, and these two go together. In terms of hormone optimization, the thing that still gets misconstrued and misunderstood is about estradiol. Study after study shows when estradiol drops, you get an increase in blood sugar, glucose, insulin resistance, and visceral fat. Other things too, inflammation, loss of bone, many other things, which I'll talk about later. But in terms of this is one thing, this is one of the key markers, right? This is one of the big things that leads to a visceral fat in abnormal body composition. We get insulin resistant, we get inflamed, abnormal blood sugar regulation, and so much more. This is why it's important to optimize your muscle mass because this can improve these things. And again, importantly, hormonally, we want to correct this as well. So this applies to men and women. And in study after study, when they give estradiol, guess what? You think that everybody's like, no, and you read the forums, now every guy out there is like, oh my gosh, I gotta lower my estrogen because when I take my estrogen's high, I'm gonna get bloated, I'm gonna gain weight, I'm gonna get bitch tits. No, it's not what happens. Actually, insulin resistance improves, visceral fat goes down. It lowers your risk of diabetes and pre-diabetes and more. And then again, inflammation, insulin resistance, this is one of the key drivers of inflammation, fat gain, and all the things I just mentioned, right? And this is what we have to correct by correcting metabolism, correcting blood sugar regulation, correcting the dysglycemia and basically the hyperlipidemia and abnormal, what we call abnormal, when people talk about metabolic syndrome, dysglycemia, or abnormal glucose or abnormal blood sugar regulation, this is what's happening, right? So again, when you correct this all gets better. This is why when guys take AIs and Estradiol, basically blockers, right? The aromatase inhibition, would prevent conversion of testosterone to estradiol. They're lowering estradiol levels. Guess what happens? They get insulin resistant. They get more visceral fat. They get bone loss. They get erectile dysfunction. They get a drop in libido. Yeah, maybe temporarily there may be some improvement, but long-term studies, they've actually studied this for years. Guys that are on testosterone, guys that are on testosterone and AI, guess what? Long-term, they get thin bones. They get a fat gut. They've done imaging. They get visceral fat accumulation. They get erectile dysfunction. They get the bitch tip. They get all the things that they want to correct, right? Rarely, occasionally, you have to use a short-term, very low-dose AI occasionally, but it's not because of the estrogen, it's other factors, and why does this work? We don't know, but typically when there's issues with testosterone, it's because of hypersensitivity of the cortisol receptor. And again, I'm not going to go down this road, but the bottom line is that you want to correct the estradiol. This is for women and for men. Women, it's a little more straightforward because women, especially when you get through perimenopause, menopause, they need estradiol. Men, you correct this by correcting their testosterone. By correcting their testosterone, their estradiol is going to correct because some of that testosterone gets converted as estradiol, which is totally normal. That's what you want. You want optimal levels. You want higher levels. Guys in their teens and have estradiol levels 70, 80, 90, 100. That's where we want to go for. Again, everyone's different. Some guys need to be lower. Some guys need to be higher. But the key thing is you want to optimize this estradiol because it's going to improve insulin resistance, improve visceral fat, improve your blood sugar regulation, improve your metabolism, and then get rid of this visceral fat. It's going to help you to build muscle and to burn fat, which is what I'm talking about. So this is why you don't want to block the estradiol. I feel like I'm beating a dead horse because this is still a big myth I see out there talking about all the time. It's very much misunderstood, even with women. I'm not sure about my estradiol, so it's about optimizing it. And again, everyone's different. Everybody has a different level, different range, a different treatment modality, but that's the key thing is to optimize this. And guess what? The studies after study after study shows this. Clinically, I see this. My colleagues see this by getting your levels to where you need to be. And again, it's not just about the hormones, right? It's about everything, the lifestyle, the diet, the exercise, the constant movement, getting sunshine, getting out there. I talk about natural medicine, getting out there, movement, getting out in the forest, getting in the trees, getting in the sun, getting your feet in the dirt. It's about a healthy lifestyle, and that's what I'm all about. So if you want to improve your optimize your health, your performance, get involved with muscle medicine, check it out. Reach out to me, drericprimex.com. I have a brand new VIP assessment program, high level, doing a super deep dive, spending hours with you doing a huge battery of tests that no one else is doing to get to the root cause of what is going on with your health and your body to get you to the optimal health that you could be in 2025 and beyond. So if you're interested, reach out to me, drericprimex.com. Everybody have a great week, and we will talk to you soon.